I'm Jessica Cruz, and I'm the CEO of the National Alliance on Mental Illness, or NAMI, California. We represent families and individuals who are impacted by serious mental illness. 10 years, wow, congratulations. I remember sitting around the table and talking to the very first fellows about NAMI and what we bring families. But what you don't know is how valuable this program has been to us. The first place that we turn is our primary care physicians to get help when we're in crisis. And now, with the thousands of trainers that have been trained through this program, we are able to get help when we need it and where we need it. So thank you so much for answering this call and stepping up and becoming the leaders that you are. Thank you to Dr. Robert McCarran for his brilliant idea and for his continued advocacy to make sure that this program stays. Keep up the great work.
Kentucky, facing a shortage of psychiatric healthcare providers, exacerbated by the opioid crisis and increased mental health needs, is turning to primary care providers to help fill the gap. The Train New Trainers program equips these providers with essential skills to handle mental health issues alongside other medical needs. By fostering partnerships and improving access to mental health treatment in underserved areas, the program aims to enhance overall patient care quality and outcomes. I appreciate the work of Dr. McCarran and the entire Train New Trainers team in helping me, as a legislator, find a creative solution to improving access to mental health care in Kentucky and across the nation.
Greetings, I'm Dr. Leandra Clark-Harvey, the CEO of the California Council of Community Behavioral Health Agencies and the Executive Director of the California Access Coalition. These two organizations are dedicated to convening all stakeholders to promote integrated systems of care. As a psychologist who's worked in various treatment settings, I know firsthand the power of teams who come together around the needs of the individual patient. A team that puts down the scope of practice wars and focuses on how the patient experiences care. I have this belief in interdisciplinary care teams because that's where I received a bulk of my training. So I know a good team model when I see one. And that's also why the organizations that I lead have been ardent supporters of the TNT model. The impact and the continued promise is great, and we will continue to stand alongside you, cheering you on today as you celebrate your 10th anniversary and many years beyond. Thank you. Thank you for investing in the best, the innovative, and common sense approaches to care. And thank you again for considering CDHA and the California Access Coalition as an advocacy partner.
Congratulations to TNT Fellowship for their 10th year anniversary. I'm Dr. Jasmeet Baines, State Assemblywoman for AD 35, and I am so honored to be an alumni of this program. TNT Fellowship helped uplift a doctor like me in a very rural part of Taft, California, trying to provide the most that I could for my patients. It helped connect me with a mentor who got me through some psychiatric cases that really needed a person to be there for them. It helped mentor me through the process, and it helped give me a higher level of services for a rural community like Taft. So again, congratulations to TNT Fellowship Programs. Congratulations on your 10th year anniversary, and thank you so much for the work that you guys do to uplift and empower physicians to provide mental health services and beyond. Thank you so much.
Hi, I'm Congressman Scott Peters, and I represent San Diego, Coronado, San Marcos, and Escondido in the House of Representatives. I want to congratulate Dr. McCarran, Dr. Barra, and the medical professionals who have made the UC Irvine TNT Fellowship Program such a success. While we've come a long way toward a better understanding of how to treat mental illness and substance use disorder, medical professionals like yourselves know how challenging it can be to access quality care. Roughly 1/3 of Americans live in areas that lack enough mental health care providers. And even in better resourced parts of the country, people in crisis often end up in emergency rooms because options for earlier intervention are unavailable. That's why TNT is so vital. Being equipped to respond to a patient's mental health needs can mean the difference between life and death, between a patient following through with treatment and a patient losing faith in treatment. Because of TNT, more than 1,000 medical professionals now have the skills necessary to recognize and treat common psychiatric conditions and substance abuse and pain-related disorders. This is a remarkable accomplishment. So to everyone here who's helped shape and grow this program, thank you for your dedication to solving this crisis. I know it's not easy, and I vow to do everything I can to make your job easier.
Greetings. I'm Eloise Gomez-Reyes, and I'm the Assembly member representing the 50th Assembly District, which encompasses the communities of Fontana, Colton, Loma Linda, Ontario, Rancho Cucamonga, San Bernardino, Bloomington, and Redlands. I would like to start by thanking UCI and the TNT program for inviting me today, even though it's virtual. Every single one of you who are participating in this program should be proud of yourselves. I'm excited to share with you the impactful work of the UCI School of Medicine's TNT fellowships. The mental health crisis is more pressing now than ever. 1 in 5 Americans has a psychiatric disorder, with mental health conditions being the second highest cause of disability worldwide. We cannot overlook the vital role of primary care in delivering behavioral health care. Roughly 50% of psychiatric referrals from primary care are not actualized. About 2/3 of behavioral health care is now provided in primary care settings. This fellowship accounts for that and seeks to address that increased number. TNT graduates have demonstrated positive outcomes, reduced opioid prescriptions to avoid contributing to the existing opioid epidemic, increased antidepressant prescriptions, and enhanced confidence in treating psychiatric disorders. We are also seeing these graduates are more in tune with their local communities. They're more likely to serve in underserved areas and train other clinicians regularly. Together, you are making a difference in behavioral health care, one primary care provider at a time. In conclusion, thank you for your support and participation in this fellowship program.
Hi, I'm Congressman Ami Bera, Dr. Ami Bera, graduate of UCI Medical School. I'm an internist by training. I think the program of training new trainers to help address mental health issues is incredibly important. This is a very successful program. We see the mental health crisis that permeates our country, but also the globe, which really is exacerbated after the pandemic. So we need folks out there, primary care physicians, nurses, others that can extend that mental health training, that can do the screenings. So thank you for putting this on. Zot, go UCI.
I'm Daryl Steinberg. Congratulations, Dr. Robert McCarran, and everyone behind the innovative UC Irvine Train New Trainers Primary Care Psychiatry Fellowship. As you celebrate 10 years, it is really important to reflect on the impact of your work. When you launched TNT, you recognize that behavioral health truly is healthcare, and that the role of primary care providers is crucial. You also recognize the status quo was not working. More than 60% of behavioral health care is delivered in a general medical care setting, and yet roughly half of psychiatric referrals from primary care are not actualized. This is a huge gap. At the same time, behavioral health training requirements for care providers are almost non-existent. You stepped up. Train New Trainers is tackling this challenge head on, and it's why this year, the organization I founded around the same time you were launching TNT, the Steinberg Institute, is dedicated to doing all we can to transforming California's mental health and substance use care systems through advocacy, through education, through accountability, and through inspired leadership. Each year, we honor Californians working in these systems to improve lives through bold ideas and compassionate care. Congratulations on your decade of impact, a decade of innovation, and a decade of saving many, many lives. Bold ideas and compassion together make all the difference in the world. We hold you and all who do the work of your project in our hearts and are very grateful. Thank you.
Hi, everybody. I am State Senator Susan Eggman, here to congratulate you on your 10th year anniversary of this great program, Training the Trainer, and the thousands of people that you have trained. I have been very lucky during my time in the legislature to be able to really work on our mental health system and pass some, I think, really profound laws, right? Finally changing what it means to be gravely disabled, redoing the structure of how we pay for services through Prop 1, through the CalAIM program, through the Care Court. So anyway, a lot of new programs coming on, and what we need is the workforce to be able to implement those programs. So the work you're doing, the work you're going to be doing is vitally important, I think, to really changing how we deal with mental health issues in California and thereby the nation. So thanks for being there. Thanks for doing this work. Don't stop and keep spreading the word. Keep training those trainers.
Hello, everyone. It's my pleasure to speak to you today as a representative of the UAE cohort 2024 on the 10th anniversary of the UC Irvine TNT Fellowship Program. Reflecting on the program's impact, I'm inspired by the strides we have made within Emirates Health Services. The program has equipped our primary healthcare professionals with essential skills to address mental health issues effectively. By creating a network of trained trainers, the TNT Fellowship have extended quality mental health care far beyond individual efforts. As an international fellow, I can attest to the program's transformative power, providing resources, mentorship, and dedicated professional network. In today's challenging mental health climate, our work is more important than ever. Programs like this are crucial in addressing these needs. Congratulations to the TNT Fellowship Program on this milestone. Your dedication is making a real difference. Let's continue to support each other and strive for excellence. Keep up the fantastic work, and thank you.